Northwest Dayton Physicians has been serving the Dayton community for more than 20 years. Dr. Long Prentice is on staff there along with Dr. Agarwal.
Hi, I'm Dr. Angela Long Prentice, and I'm a physician with Northwest Dayton Physicians. And we're located at 3535 Salem Avenue in Dayton. And it's not too far from Good Samaritan Hospital. The practice has been here for about 5 years. We're good, well established in the community.
Dr. Long Prentice has some advice for patients to make their visit more productive.
If a patient wanted to make a visit with me more productive, probably the best thing that they could do is come with a list. When they come with a list, they're prepared. They know what it is that they're concerned about. They can direct me a little bit easier. I find that patients that know what their goals are, I can help them reach those goals, but I just need to know what it is that they're really interested in. The patient that comes in and says, you know, I had this cold. It started out with this, and I had this, and this, and these were the symptoms that I had, and then that's when I tried this medication. Boy, they're doing my job for me. You know, it makes it much simpler. The patient that comes in and I'm kind of leading them and guiding them, I mean, that is my job. I don't mind doing it that way. But it can be really beneficial when they already know. The prepared patient already can tell me what their diseases are, knows what surgeries they have had, knows what medications they're on. You know, they have their information already prepared, or it's easy to get it from them.
Communication is key when dealing with your doctor.
A lot of people go to doctors and they have, doctors speaking doctorese or whatever, some type of language that they don't know what the doctor's telling them. It confuses them. They're not certain why they're taking a particular medication. They're not certain why they are even, there. They come in with complaints. They know what their symptoms are, but they don't know anything beyond that. And that's really their job. I've got this problem. I'm coming to you. I need help. My job is to then come along and say, okay, well, this is what you're telling me. This is what I'm saying. Let me examine you. Oh, this is what we found. This is what the problem is. Hey, let me explain to you what's going on with you. Make sure that they understand that. And then, okay, this is why now this is how we're going to treat it.
Trust and compassion are important at Northwest Dayton Physicians.
I think that one of the things that I hope that I do well is I establish with my patients that I care about them. When they come, I'm not just asking questions because I have to gather information. I'm asking questions because I genuinely want to know what information I can gather on them so that I can make sure that I can provide the best care for them. Because that's the only reason that they're coming to me. I mean, there's nothing better than when someone comes to me for care or they bring a family member to me for care, somebody that's already established with me and they bring a family member. Boy, that does show that they trust me. I have some members in my practice, one particular family. There's a lady that I take care of her, I take care of her daughter, I take care of her granddaughter, and I take care of her great-granddaughter. I mean, that's so cool. That's why I do this.
Hospitalization of patients has evolved, and Dr. Long Prentice counts on the hospitalist to keep her abreast of her patients' care.
The hospitals will admit them, will see them throughout the hospitalization, prepare their discharge summary, and then get a copy of that discharge summary to me. That's how we know why our patient was in the hospital. Then when they come in for follow-up, we have all the information. Now, ideally, obviously, with our electronic charts, it's really great when they go to Good Samaritan or Miami Valley because that's who we're directly affiliated with, and we can get the information just like that.